We now recognize the gentleman from Oklahoma, Mr. Lankford, for 5 minutes.
Thank you, Mr. Chairman. This new language that was added in, it's different than the previous contract that for 5 years they had. Obviously, they've done a good job on it in the past. That's well established. There was some decision made at some point, I assume based on data. Is there data out there somewhere saying that there was a portion of individuals that were interested in these other abortions and contraceptives and such that didn't get it and had complained back, or was there some study that was done determining that this is not being provided and this is a problem?
There is research indicating the needs of this population, and based on that research, and we would be happy to provide that.
Well, I'm just wondering, in the specific fulfillment of the contract, there was data that was provided saying that these things are needed and they're not being provided, and the Catholic bishops are prohibiting this, or because obviously the Catholic bishops are not providing the health care. So they're sending them to clinics, and then the HIPAA laws kick in, and they don't know what's happening at that point. They're the caseworkers that are connecting them with the clinic, and then health care is provided there. So I'd assume there's some data saying, and they were prevented from getting these services.
What I can indicate, and we will provide you, is the provisions that they provided in their subgrant, their subcontracts to subgrantees, restricting the options that those
So restricting repayment for that, correct? Is it just not saying you can't do it, but saying don't ask us for repayment for these services?
We will provide the specific information to you.
Okay, that'd be great, because my understanding was it's just they're not saying you can't do that, you're prohibited, we're going to reach into your doctor's office and tell you what to do and what not to do. They're just saying if this is performed, don't bill us for it, because we don't reimburse for
under
that.
the terms of the original contract, as well as the terms of this grant, none of the dollars of this grant are for the actual delivery of services.
That's what I'm saying. So that relationship, they're not prohibiting it. They're basically saying you won't be reimbursed through us, or that's not something we encourage. Or
I'd be happy to provide the specifics, but
if the gentleman would yield for a second or stop the clock. For the record, when I opened and mentioned the documents that we had obtained that had not been provided by HHS that the press had, which I understand have now been accepted, and hopefully the reservation is now withdrawn. It's withdrawn. Additionally, the documents which the gentleman is saying he will provide were requested and have not yet been delivered. So although I appreciate your saying you'll deliver them, we will expect full supplemental responses in writing, or we'll bring you all back, because this is part of our problem, is that these documents, which we suspect say what Mr. Lankford is saying, we won't know for sure. So if you can, to the greatest extent possible, make assumptions of what you believe they say, it will prevent coming back, because we're all pretty sure that Mr. Lankford is correct as to his assertions.
we will do that, but I also would be happy to come back.
You're first. With that, the gentleman may resume.
Thank you, Mr. Chairman. Then with this shift and what happened in the previous contract, there had to be a decision made at some point based on data or based on decisions saying this was a problem. They did great in all these 6 areas, except they didn't encourage people to have abortions or encourage contraceptives. Because obviously, as you mentioned before, they're not providing. They're just encouraging and sending that message out. So because they're not encouraging contraceptives or they're not encouraging abortions, we're going to put language in there to make sure they do next time. Who made that decision, and when was that decision made?
Well, that decision was made, again, prior to my getting here. But as my understanding, was made based on research in terms of the needs of this particular population.
And the fact that it wasn't fulfilled in the previous contract, or just other research separate from that? Because in the previous, if there's a change in the language on that, who made that decision then? When was that decision made?
I believe that was a collaborative decision in the development of the FOA, but I'll ask Iskender to.
Mr. Nagash, can you let us know, because obviously you were there during that time period as well.
I believe that the process of developing the FOIA, the Office of General Counsel, the policy expert who is an SAF and HHS, including the leadership, made a point to include that language.
Okay, so can you list the names that you would say there? Are you listed titles? Can you list the names here of the people that were involved?
Well, I believe that the Office of the Assistant Secretary at that time, not Mr. Sheldon, the Office of General Counsel, I can give you the list of who those people are, and I believe the Office of the Secretary also.
Okay. So Kathleen Sebelius was involved in that, and as far as making that decision to have that language involved.
I don't have any contact with the
Right,
secretary.
but it came in from that office.
I believe that the office of the secretary was reviewing
The issue is, and this is something we've talked about in contract writing and in grant writing, and the reason I bring all this up, because at times grants and contracts are written in such a way to deliberately exclude people, and to say, I'm going to write this in such a way to make sure only a certain group would be eligible for this. And if this language is written in such a way, there's a couple of problems here. One is the clarity of the exclusion, to say that there's a priority, or that we're looking at it, or this is important to us, is one thing. But to say, unless you encourage abortions and contraceptives, need not apply, that type of certainty definitely is not in there. But the way the language is written, it establishes this process that, hey, anyone who has this belief should not apply unless you're willing to give up your beliefs. Unless you're willing to encourage abortions, don't come. So the language is written in such a way to exclude a group that had currently done it for quite a significant time and had done a good job. And what I'm interested in is there data that's connected to that, saying this was a problem in the previous 5 years based on this data. We found this data from doing this, and so we need to make this shift to purposely exclude the group that had done it in the past that had high marks. And so that's the struggle here, and it goes into the whole essence of how we write grants and how we write the proposal. If the administration has determined in these areas you have to promote abortions or we don't give you U.S. funds, say it. Just come out and say it. Don't go through the whole dog and pony show. Make it clear at the very beginning, and to keep that priority. So with that, I will yield back.
I thank the gentleman.